Have you noticed that some medicines that used to work very well no longer seem as effective? Someone takes antibiotics today, and after a few days, the infection is still there. The person changes drugs, tries another one, and sometimes even a stronger one. What's going on? Today on Synapse NG, we are talking about a growing global challenge called antimicrobial resistance, or AMR. I am Dr. Akimbobola Otitoju, and welcome to the Synapse NG. Trust me, this is something everyone should know about. What is antimicrobial resistance? Now, let's start simple. Antimicrobials are medicines used to fight microorganisms such as viruses, fungi, parasites, and bacteria. Antibiotics, for example, are used against bacteria. Normally, when you take the right antibiotic, it kills the bacteria causing the infection. But over time, some microorganisms learn how to survive these medicines. At the molecular level, they develop tricks to protect themselves. They can change their structure. They can pump drugs out of their cells or even produce chemicals that destroy the medicine before it can work. The result is that the medicine that once killed them no longer works. This is antimicrobial resistance. Now, the question is, how did we get here? Unfortunately, human behavior has played a major role. For example, many people use antibiotics without proper medical advice. Some stop treatment as soon as they feel better. Some share antibiotics with friends and family. Some even use antibiotics for illnesses caused by virus, such as many common colds. And in some cases, antibiotics are used excessively in livestock and agriculture. So every time microorganisms are exposed unnecessarily to these drugs, the strongest ones survive and multiply. So it's basically evolution happening right before our eyes. Why should we care? Because antimicrobial resistance makes infection harder and more expensive to treat. Simple infections that were once easily cured can become serious. Yes, surgeries can become riskier. Childbirth can become riskier. Cancer treatments become riskier. Even a minor wound can become a major problem if effective antibiotics are no longer available. According to global health experts, antimicrobial resistance is already contributing to millions of deaths worldwide every year. So the question is, what can we do? The good news is there is a role for you to play, just as I am playing mine right now. Use antibiotics only when prescribed by qualified healthcare professionals. Complete the full course as directed. Don't stop halfway simply because you now feel better. Never share antibiotics. Practice good hygiene to prevent infections. Stay up to date with recommended vaccinations. And remember, antibiotics do not treat every illness. I must emphasize on this. Antibiotics do not treat every illnesses. Whew. The next time you take an antibiotic, please remember, you are not just treating an infection. You are also helping determine whether these life-saving medicines remain effective for future generations. This is Synapse NG, connecting science to everyday life. And when it comes to antibiotics, use them wisely today so they can save lives tomorrow. All right, till I come your way again next time, stay healthy. Bye for now.